Hello friends, today we are going to discuss about a very important marma in our body, the Kakshadhara marma. The Kakshadhara marma is the first marma in the upper extremity. It is, as per Acharya Sushrut, defined as the Vaikalyakar marma or disability causing marma if there is severe trauma on it. The width or size of this Kakshadhar marma is 8 angul and it is a snayu marma. Snayu marma can also be referred to as ligamentous or tendinous marmas are called as snayu marmas. So Kakshadhar marma lies in the deltopectoral groove just at the end of lateral 1/3 of clavicle. It is just below that lateral end of clavicle. The benefits of Kakshadhar marma stimulation is it is very beneficial for patients of frozen shoulder or patients having stiffness in the shoulder joint. Also, if there is a muscle wasting in the upper shoulder region or in the scapular region, this marma point is to be stimulated. Also, if there is a pain in the shoulder joint, we use the stimulation of Kakshadhar marma. If there is injury on this marma site, it can lead to bahu shosh or disability in the upper limb. Bahu shosh is muscle wasting and disability is loss of functions of the upper limb. The actual site of Kakshadhar is just below the lateral 1/3 of clavicle, 2 finger beneath it. I will be describing this in my today's talk, how to locate this. The Kakshadhar marma can be stimulated both in sitting posture as well as supine posture. However, it is better to stimulate it in sitting posture. So friends, now we will discuss about the technique of stimulation. So I am going to show the landmark. This is the clavicle. Okay. And this is the acromioclavicular joint here. And here lies the coracoid process of the scapula. Okay. So once you have identified the landmark here, this is the lateral 1/3 of the clavicle or the collarbone. So from this you go approximately 2 finger breadths down. 2 finger breadth means like this. Okay, and push and keep your thumb like this. 4 fingers goes on the back for support, and then apply the pressure towards an imaginary line which is created from this point to the acromio or to the coracoid process. Okay, so you draw a line from this point to this point, right? Then with the help of the pulp of the thumb you apply the pressure like this. Okay, press and release. Take deep breath in and out slowly. Press and release. The Kakshadhar marma is stimulated in such a manner, and it also, besides helping in the shoulder stiffness, shoulder pain, frozen shoulder, it also good for improving the lymphatic supply or lymphatic drainage from the axillary region. The patient is asked to keep the head still, the body straight, and in a relaxed manner. As you can see, I'm applying pressure from this to this point. So the pressure is slightly upwards and backwards and not downwards, because just below here, if you go down from this side, here is the brachial plexus or brachial vessels. So if I'm stimulating here, then the chances of brachial plexus injury is there. So one must be very careful not to go down. For self-marma therapy, we ask the patient to hold the shoulder joint with his opposite hand and with the pulp of the thumb pointing upwards and backwards from the marma point, the moderate pressure is applied. The technique of stimulation, we stimulate by rhythmic fashion in the same way in which we take our breath in and out. That is, in 1 minute, approximately 18 times, we apply intermittent pressure. It is not a continuous pressure that we apply for stimulation of the Kakshadhara marma, but an intermittent pressure. Just press and release, press and release, in the same way in which we take our breath in and out. When do you have to press? You press when you are exhaling and release when you are inhaling. The whole press and release action will take approximately 3 seconds. So in 1 minute, approximately 18 to 20 times we are stimulating this Kakshadhara marma. Now, how much pressure is to be applied is very important again. The pressure application on Kakshadhara marma is moderate, as I said earlier. Now, what is moderate here? Here it is, in general terms, approximately 6 to 8 pound pressure is applied. However, the amount of pressure applied also depends upon the age of the patient, the sensitivity, or what we call as the sattva of the patient, whether the patient is prava sattva, madhyam sattva, or ava sattva. So based on some of these criteria, we determine what should be the adequate pressure. It is also important that if you apply slightly less pressure, it's okay, but we should not try to apply extra pressure, because if we apply extra pressure, then there are of course chances of injury, like swelling, hematoma increasing, or loss of restricted movement of the shoulder joint. Okay, so I hope, friends, now we can stimulate this on ourselves as well as on others as and when needed.